All right, let's talk about nursing management for people who have contracted HIV. Sharing of the screen is happening now. Fantastical. One little thing, fantastical. So we're going to be doing ADPI, right? Our assessment. First of all, we need to put any assumptions that we have about who may be at risk for developing HIV out the window. Let me say that again. Do not make assumptions about who may be at risk. With the variety of different relationships that people can have in their lives and the variety of different work that people could do that have a puncture risk, there is a variety of different ways that a person can develop or acquire HIV. What we do need to do is have kind of conversations about effective management of HIV. We will be, after we've screened for at-risk patients, here are some different common questions that we can ask those people. Did they get a blood transfusion or clotting factors before 1985? Have they had a shared drug using experience? Do they share their needles? Have you had a sexual experience with your penis, vagina, rectum, or mouth in contact with these areas of another person? And have you had a sexual transmitted infection? All of these people who would answer yes to any of these questions are now at risk for developing HIV. Any person who is diagnosed should be assessed thoroughly with past medical history, current medications, functional health patterns, and a presence of symptoms using a systems review. So we really do need to fully look 100% holistically at this person, rather than just, oh, you've got some swollen and lymph nodes and a fever, here's some Tylenol and push fluids. For planning, our goals of care are aimed at getting adherence to drug regimens. It's huge to get adherence to drug regimens for a couple reasons. First of all, the drug regimens can be really expensive. And secondly, they are very specific in their time. So if you have somebody who's working variable shifts, if you have somebody who has variable access to cash, meaning that they float in and out of employment, or if they have variable access to housing because they're floating in and out of housing, you've got some problems that are going to be impacting your drug regimen as well. We were going to be working with them to adopt a healthy lifestyle, protecting others from HIV, beneficial relationships to them, exploring spiritual issues that may be tagging right along with this infection, and coping with the disease and its treatment. When it comes to implementation, when it comes to prevention, there are a few different preventative measures that we can do. So primary prevention and health promotion are the most effective strategies for diseases of a chronic nature, including HIV. So needle exchange programs, bowls of condoms, great education about how HIV is actually spread. It used to be, and not so long ago, that, and you may have heard this in your life, that HIV is a gay man's disease and only gay men can get it. Incorrect. Other preventative measures are increasing safer sexual practices, decreasing risks such as IV drug use. It's beneficial for so many different reasons. Decreasing perinatal transmission, so getting mom on some really good antiretroviral therapy so that we can have her be therapeutic and reduce the risk. Like I said, 25% risk down to 2 if we have mom on good antiretroviral therapy. And any sort of work that you may be doing, not necessarily work that you may be doing, but how you're doing your job. So there is a reason why when you are capping a needle after you have given it a shot, that you fish the cap and then put it on, that is preventing a puncture wound and anything that that person may or may not have in them. So we fish the cap, or we have the safety things that once we plunge the shot in, the needle retracts. There's a variety of different safety measures that have come around needles and healthcare workers for prevention and decreasing risk of transmission. When a client is in the acute phase, early intervention can promote health and limit disability. So they are going to be, this is a life-threatening chronic illness. So people are going, this is a big change. This is going to, like I said in the beginning, unless there's some sort of weird traumatic accident, this infection will be what takes their life. So panic, anxiety, fear, guilt, depression, denial, anger, hopelessness, all sorts of different psychosocial emotions are going to be coming into play when we are working with people who are in the acute phase, because there is a lot that goes along with having this diagnosis. Antiretroviral therapy, ART, can significantly slow HIV progression, but it is complex. It has side effects. It does not work for everyone, and it's wicked expensive. So if you've got somebody who is got transient housing, meaning they're in and out of shelters, you've got somebody who's an IV drug user who develops HIV, it is super hard to be adherent when you are in need of fixes because you're an active drug user and you have no housing. If you can't afford housing, it's really hard to afford your antiretroviral therapy medication. Even if you can afford housing, it could be stupid expensive, and it could be so stupid expensive that you have to give up your housing to be able to afford your medication. So ART is recommended as soon as possible after diagnosis. Patient readiness is the most important concern. So nurses can educate and provide support, including medication adherence counseling. Adherence to drug regimens is critical to prevent disease progression, any opportunistic diseases, and viral drug resistance. And an individualized approach is best. So people who work with this population on a regular basis are amazing at holistic patient-centered care, because the better they are at holistic patient-centered care, the more likely it's gonna work. So the other intervention is we can delay progression. So that's the whole goal of antiretroviral therapy, is to delay progression. In addition to medication, here's what we can do. We can provide nutritional support. So we can encourage healthy eating habits, DASH diet. How are we moving through that? Are you getting enough exercise? What's the American Heart Association saying about how you should be moving through the world? How often should you be moving? What sorts of foods are great? What sorts of foods could you avoid? So we're going to work with them on moderating or eliminating, ideally eliminating, alcohol, tobacco, and drug use. Not their ARTs, but their illicit drug use. Keeping up to date with vaccinations is wildly important. If they can keep up to date with their vaccinations, especially if they aren't getting live attenuated vaccines, but if they're getting the vaccines that are the dead pieces, that's amazing, because then those people can get exposed to their remaining immune system is given that much more of a chance to actually get the jump on fighting off any sort of infections. Adequate rest and exercise is wildly important. Avoiding exposure to infectious agents So one of the things that I think is pretty cool right now is that before COVID, people were really like, if you were wearing a mask, you had something seriously wrong with you, or you were a danger to society. And now surgical mask wearing has become more accepted. There are times where if you were wearing a surgical mask, you may feel very uncomfortable because of the looks people are giving you. But they're inexpensive, if not free, from a variety of different agencies, and they're more accepted than what they once were. So protecting from those infectious agents is easier, not easy, but easier now. And counseling and support groups. So they're going to be going through some very hard changes. And for that psychosocial, emotional part of fighting a chronic illness, whenever you've got a chronic illness, a support group and counseling can definitely help people. And in this case, that holds true as well. So I'm going to stop sharing because now I have reached the case study to help you process the information. I will post these onto D2L so that you can have a look-see at them at your leisure, and I will see you in class.